So yeah, there's been this enormous progress. However, there are still, I would say, two main domains where we are currently looking at that have significant unmet needs. The first one is women with hemophilia A. So previously they have been mostly categorized as carriers of hemophilia A without having hemophilia A proper. However, if these women have in fact 8 activity levels under 40%, they definitely have hemophilia. And so that mostly looks at, for example, menorrhagias, which are not always being adequately captured because these women are often misdiagnosed or underdiagnosed. So what we try to do is look in the data sets where we find women with hemophilia A. For example, we are presenting also on the Picnic Health dataset, where there's 23 women with hemophilia A, where we find that compared to men with mild hemophilia, they have a much later age of diagnosis, and also more higher prevalence of anemia. Then we're also doing our best to understand how women treated with Emicizumab looks like. So there's, for example, there's 3 women in the Haven 6 trial, and there's also 3 women in the ATHON, in the American Thrombosis and Hemostasis Network, that's also being presented at this conference. So that's the first major unmet need. I think the second one would really be on infants with hemophilia A. So that's children under 1 or 2, depending on the cutoff. That historically have also had trouble getting prophylaxis treatment. So basically, the World Federation of Hemophilia, they would recommend severe hemophilia A patients to start on prophylaxis as soon as possible. However, with intravenous infusions, that can be difficult because, well, the veins can be difficult to find. Now, with Emicizumab, there's a potential to treat them subcutaneously, which means that the prophylaxis can be started earlier. And so we're also presenting the Haven 7 clinical trial data at this conference, which found more than 77% of infants did not have bleeds that required treatment. And for example, there's also a very interesting abstract or an oral presentation at this conference from the US Community Counts Registry, which saw that more than 85% of the children are being initiated on Emicizumab.